The best premolar extraction debate you'll hear in under 60 seconds. Here it is. I've spent days digging through the science so you don't have to. So comment, share, and save this because this is a breakdown every orthodontist and airway-focused doc needs to hear. So here's the question. Is it really about the tooth itself or about the fact that patients who need extractions already start with small jaws, crowding, and narrow airways? Because if that's true, the whole conversation shifts. So back in 2019, the American Association of Orthodontists released their white paper on sleep apnea. They told us orthodontists should screen for OSA, good, collaborate with physicians, and consider mandibular advancement devices. But they stopped short of saying orthodontic treatment, including extractions, directly causes or prevents OSA. But here's the nuance. Extraction patients already begin with compromised anatomy. They have crowding, retruded mandibles, constricted narrow arches, the very features tied to smaller airway volume and higher risk of sleep apnea. So the question isn't extraction versus non-extraction. The real question is, how do we design the overall treatment plan to protect or improve the airway? So now, since 2019, since that paper, a lot of evidence has exploded. There are systematic reviews confirming that patients with OSA consistently have smaller jaws, retruded mandibles, longer faces, narrow arches, all reducing airway size and increasing airway collapsibility. Other studies showed that dental crowding and narrow palates reduce airway volume and directly correlate this with OSA severity. Another study shows oropharyngeal crowding. When the tongue simply doesn't fit the jaw, it's independently tied to OSA severity, regardless of body weight. And the American Heart Association, the AHA, explicitly recognizes underdeveloped jaws as a pediatric OSA risk factor. So I'll ask this because I'm curious. Now that we have years of new evidence since the 2019 paper, does anyone know if the AAO has updated their 2019 position? I've yet to find this, but please share if you do. Because the science is clear, the airway isn't optional, and if we ignore it, we miss the root cause of disease, and we're seeing this. The only question left is whether our profession is ready to acknowledge it.